Hi, everyone, and welcome to Frankly Speaking About Cancer, Coping with the Cost of Care. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities. Just bear with me a moment while I load this on Facebook on my phone so I can see what you're seeing. Perfect. All right. So as I'm going through this presentation, I'll be monitoring comments on Facebook, so feel free to comment any questions that you might have during this program. I'm going to start sharing my screen, so give me just a moment. There it goes. All right, so today we're going to talk about the cost of care. I think it's a really important topic to talk about. It's not the most fun topic, but I think most people get surprised by cost of care, and it's such a complicated system to navigate with doctor's visits and bills coming in from every way, shape, and form, and insurance can be so complicated. So I'm hoping to give you some tips and tricks to help navigate all these systems and give you a place to go if you ever run into any problems. So all of our slides are always reviewed regularly. These ones were reviewed in May of this year. And I also, I've worked with Medicare, Medicaid, and a lot of benefits pretty extensively. So I added a lot in here as well. Just a couple of disclosures. All right, so I'm going to talk about Gilda's Club Quad Cities a little bit at the beginning here. I'm going to talk about insurance. So that's our insurance that sometimes we see through work. I'm going to talk about Medicare and Medicaid, how to get medications and help paying for those, and talk about employment and disability, and just income and managing medical debt and how to deal with all that. And then like I said, I'll be monitoring comments on Facebook, so feel free to comment in any questions you have. So a little about Gilda's Club Quad Cities. So we are a cancer support community that offers 100% free psychosocial support to anyone impacted by cancer. So with that, we're talking about the person with an active diagnosis. That's survivors, that's friends, family, kids, and teens, anyone impacted by a cancer diagnosis. And with that, we have support groups. We have educational workshops like this one. We have healthy lifestyle activities like yoga and meditation. We have social events, kids and teens programs, and we're also a hub for resources and referrals. So as we're going through this cost of care workshop, that's one of the calls we get a lot, are people who are having trouble paying for one thing or another because of their cancer diagnosis, whether that's having a hard time paying for their actual treatments or a drug, or they're having trouble paying for their rent or mortgage because they had to take time off of work for treatment. We're there to help with resources and referrals if anybody ever runs into problems with any of those things. So background, I feel like this is, I think everybody knows this cancer care is expensive. Unfortunately, every doctor's visit, every surgery, every infusion, x-ray, and pill, come with a price tag. And a lot of times those price tags are very hefty. Luckily, insurance can pay for a lot of it, but insurance doesn't always pay for everything. And sometimes people get their insurance through spouses or parents. And if ever anyone is having trouble getting insurance one way or another, let us know. We can help navigate through that. And also health insurance doesn't cover everything. Most insurances have a deductible. We'll get into all these terms, but insurance almost never pays 100% right off the bat. And a survey done by Cancer Support Community, nearly 70% of people who responded to this survey said that they had unexpected expenses during cancer treatment. Also, talking about money can be difficult. Like I said, this isn't a very, fun topic, but it is important. And a lot of times your doctors, the healthcare teams, the nurses aren't going to raise the issue about cost. They're just trying to get you the medical care that you need. But it's okay to ask about costs, especially with there are usually financial people, available billing people at your doctor's office. So understanding your options is important in all kinds of different ways. So that's understanding your options with choosing your medical care. That's your different options when it comes to insurance to help pay, and your different options when it comes to paying for things that insurance doesn't pay for. And also think about when you're maybe starting treatment for cancer, those non-medical costs, possible loss of work or hours if you need to take time off because of treatment. Needing more help at home. You may need somebody to come in and do things that you're not able to do while you're not feeling well. And think about things like transportation. If you have to go to and from Iowa City, maybe for treatments once a month or doctor's appointments here and there, that's wear and tear on your car, that's gas, and it all costs money. So first thing we're going to talk about is health insurance. I'm going to get pretty in-depth here about different types of insurance and definitions of different things. So a lot of different ways to get health insurance. The most traditional way we all think of is through a job, employer-sponsored health insurance. But there's COBRA for if that ends. There are now marketplace plans that we'll get into, Medicaid, Medicare, veterans, TRICARE, all kinds of different ways to get into an insurance policy. You can go to healthcare.gov to be able to get a little bit of help with finding these things. So private health insurance. One thing to differentiate is group versus individual policy. So group is usually like a job insurance where it's a bunch of people going in together for an insurance policy, or you can buy your insurance yourself for an individual policy. I'm going to skip the types for a second here. I'll come back to that. But there's also insured versus self-insured. So a company may be fully insured through a company, a workplace may go through whatever insurance company, or they can, some large companies are self-insured. So instead of paying an insurance company to do that job for them, they collect the premiums themselves and pay out for when there are claims. And there are grandfathered plans. We're not going to really cover a lot of that because those are really specific depending on the plan that no longer exists but has been grandfathered in. But so some of our main types here, going back up a couple of bullet points, are the two main ones you'll see are HMO and PPO. So HMO is a really common one. They tend to be very cost friendly when it comes to premiums, but everything in an HMO has to be in network. Typically, you need a referral from your primary doctor for any specialists, and a lot of times with HMOs, things that are out of network, so they have a very specific network of doctors, hospitals, providers that you can go to. Anything outside of that isn't going to be covered at all. You're going to have to pay 100% out of pocket. So it can be really good on your wallet when it comes to premiums. It's sometimes difficult to manage your care because you only have a certain number of providers you can go to. So a point of service plan is you need a referral from your primary doctor for specialists, but you don't have to stay in network, but you'll pay more when you go out of network. A PPO is, you can see specialists out of network without a referral, but it usually is more expensive. PPO typically are higher premiums than an HMO. EPO and FFS, the exclusive provider organization fee for service, are ones we don't see a whole lot. EPO, it's lesser known. It covers only in-network care, but the networks are usually larger than HMOs. And fee for service is you can see any provider you want, but it usually costs more. And those are becoming less and less common. Most of what you're going to see are somewhere in HMO, POS, and PPO. So it's always good to check and compare all of your options when you're being faced with a decision to change or go into a health insurance situation. So you may be offered healthcare coverage through your employer, but you can look into other options like the marketplace, Medicare, Medicaid, veterans benefits. Um, the it's good to compare all of your different options. Just because your job offers you insurance doesn't mean that it's always the best insurance for you. And sometimes they offer more than one type. You need to, compare all of those. So the things you need to look at are premiums, deductibles and co-payments, and your co-insurance. I'm going to define those. So our premium is what we pay every month just to have the plan. So when you're working, it's the thing that's being taken out of your paycheck every month to have the plan. So usually how it works for a lot of organizations or companies that you work for is the person who works there is very cheap. So that person may, it may be a minimal cost to have that person insured, but a lot of times when you add another person onto those plans, that premium goes up a lot. Like if you're adding a spouse or a dependent, a child, sometimes those can go up a whole lot. So whenever you're trying to add another person into an insurance situation, always look at what that's going to cost. It may be cheaper for them to get insurance somewhere else. So when it comes to looking at the cost of comparing different insurance situations for yourself, you have to kind of add all these things together. So your premium is what you're going to pay per month. So take that times 12, that's what you're going to pay per year just to have the plan. And then your deductible is what you pay before a plan even kicks in. So sometimes these are really low. They can be a couple $100s. They can be very low. Sometimes they're really, really high, thousands and thousands of dollars. It can be, $10,000 for a family deductible. So knowing that most of your benefits won't kick in until after that deductible is met. If you think you might be incurring a high cost of care that year, like a cancer treatment would be, you may want to look at what that deductible is and you may have to pay all of that deductible out of pocket before your plan starts to pay for anything else. And so copays are also like, maybe you have to pay 5, 10, 20, whatever amount of dollars every time you see your primary doctor. And then usually that copay is higher if you're seeing a specialist. So maybe it's 80, 100, depends on the plan. But those are things that you have to kind of get an idea in your mind of how much am I going to use this plan? Am I somebody who I'm not going to go to the doctor very often? I don't need a whole lot of healthcare. Something with a low premium and high copays may work because you're not planning on going to the doctor a whole lot. But a person who may be going to the doctor every month, a couple of times a month needing, especially if you're getting a cancer treatment, you're going to be going to the doctor more often. And so those copays, even if they're $50, that seems okay once, but it might not be okay if you have to go every week. And then co-insurance is usually what you pay after your deductible is met. So deductible, you have to pay out of pocket the full thing. And then once that's met, a lot of times you'll get, when you're getting into a plan, you'll get a little table that says after deductible, the plan will pay 80% and the person pays 20%. So even after the deductible is met, you'll still usually have to pay a certain amount, a percentage, depending on the plan. But another big thing to look at, especially if you're facing cancer treatment, because those can be very expensive, is out-of-pocket max. There are at almost every plan, except for traditional Medicare, really, but almost every plan, one way or another, has an out-of-pocket max, where once you hit that number, you can't pay anymore. Like the plan will pay for the rest. And a lot of people with cancer treatment are going to hit that out-of-pocket max. And sometimes, depending on the plan, there can be high deductible plans where the deductible and the out-of-pocket max are the same. So look at all that, just so many things to compare. But there is help with that. You can go to healthcare.gov and you can call us and we'll happily get you to the right place or help you ourselves, because it can be really complicated comparing these different things. Another thing is making sure your providers and healthcare facilities and pharmacies are included in your plan. That's a big thing with those HMOs and PPOs. An HMO is usually cheaper for your premium, but if you're facing something like cancer treatment where you may need to see your primary doctor, an oncologist, a surgeon, lots of different moving pieces, it'll be harder to fit all of those into your network. It's doable. It's totally, it can be doable, but you will have a smaller number of providers that you won't have to pay 100% out of pocket for. And another thing is making sure that your prescription drugs are on your plan's formulary. We'll get into that a little more when we start talking about prescriptions, but always check with an insurance if you have your list of medications that you are taking or feel like you're going to start taking. You may not know, you can't always know, but you can always check before you go on to a health insurance if your drugs are covered. And here's Cancer Insurance Checklist is a really, really great resource for making sure that you're ready for incurring these when bills start coming in and when you want to make sure that your insurance is right for you. So here's the anatomy of an insurance card. You don't need to know everything about your insurance card. There are a lot of numbers and things on an insurance card that you'll never use. You can go through all of this if you want, but the big things is knowing your insurance company. That I've worked with so many people that don't even have any idea what insurance they're on. When they sit down with me, I say, all right, so what insurance do you have now? And they don't know. So I have to do a little digging and go through their cards. But it's good for you to know what insurance you have. So the insurance company name is important. Whether it's an HMO or PPO is important, just so you kind of have an idea of the flexibility of your plan. You need to know that big ID number. It's usually a big, long number. Sometimes it's got all numbers. Sometimes there's some letters mixed in. That's a really important number to have. And on the back, it's sometimes on the back, sometimes on the front. But there should be a member services number. That's your number. That's your number one phone number to call whenever you have any questions. And then a lot of times there's a separate pharmacy drugs phone number. So just some tips for optimizing your health insurance is try to get pre-authorization before you have any procedures done. A lot of times people get denied a benefit or denied being something being paid for by their insurance because they were required to get pre-authorization, they didn't know. So whenever you know you're going to get something done, surgery, a procedure, whatever, call your insurance company. That member services number should be really prominent on your card and ask if you need pre-authorization. If so, what do I do to get that in? That way they know it's coming, they've approved it, you're good to go. Make sure that your doctor or any provider that you have submits bills to your insurance company. There are some still that don't. Almost all of them do, but here and there are providers that don't accept insurance or don't bill where you'd have to do it yourself. And that is such a pain. Most doctors will do it, but make sure they know about all your different insurance plans. Like if you're on Medicare, you may have traditional Medicare, you may have your Part D plan, you may have your supplement plan, all these different things. Make sure they know about all of them because all of them may pay for different pieces of your care. Always review your bills for mistakes. We love our doctors and our billing people at doctors' offices, but they are human. Sometimes things get typed in wrong. Always look for mistakes. And then review your explanation of benefits every time they come in the mail. And especially when you're going to the doctor a whole lot, they come a whole lot. But always look at them, but be wary because when you get an explanation of benefits from one of your insurance companies, it's just for that insurance company. So say you get an explanation of benefits from Medicare and it may say, hey, you had this thing done. You're like, yep, I had that thing done. This is what Medicare pays and this is what you may be required to pay. It always says may. And take that to heart just because it says you may have to pay, you may have to pay $200 or whatever it is. If you have another insurance like a Medicare supplement plan, that plan may be taking care of that. Depends on how your insurances work together. But know that explanation of benefits and what you might be responsible for is just for that one piece of your insurance. And always match your explanation of benefits to your bills. Make sure they match. One thing I would suggest is make an insurance file. If you're expecting to get some bills coming in, if you're starting some cancer treatment, make an insurance and medical bill file. You can request an insurance case manager. A lot of times one will be offered to you, but if one's not, request one. They're a great advocate on your behalf at your insurance company. And if you can't get that, always try to speak to the same person. And regardless of who you're speaking with, always take really careful notes. This sounds so annoying and it's a lot to do, but write everything down whenever you're on the phone with your insurance. Date and time, who you spoke to, if they have like an employee number, whatever you can get, just to prove your case if ever there's a denial that you need to prove anything. And keep all of those notes, all of your explanation of benefits, all of your bills, all in this file so you have them together. If ever you get a pre-authorization, ask for it in writing, put it in the file. So know that whenever something gets denied at your health insurance, you can always appeal. I always say never hurts to appeal, even if you don't think something should have been covered, because you never know. So insurance can be so complicated. There can be such little reasons why something's denied or approved. You can always, usually the first step to an appeal is like an in writing appeal. There's information on appeals usually on the back of your bill. If you really think that something should have been covered and it wasn't, or it should have been covered more, but it wasn't, you can keep going on those appeals. You know, you may do an in writing first level appeal and they say, no, we still deny you. You can keep going. There are always next steps. Always look at deadlines and keep a copy of everything when it comes to appeals. If you are on an employer-based plan, it can help to let HR know that you received a denial for care, depending on how they kind of deal with their insurance, but just so that they know. You can always ask for help when it comes to these things. So they're like consumer assistance program, things like that. A lot of times when people are denied something like full out, that they're not going to pay for any of it, it's because they needed it to get pre-approved or pre-authorized. So make sure before you get anything done that you check if you need pre-approval or pre-authorization. So this is a resource that I added in. I think that they're great. It's called the Patient Advocate Foundation. So they provide free case management and even have grants to help with like copays. So their website and their phone numbers are listed there. I think it's a great resource for if you're just not sure if something should have been paid for, something should have, you know, they should have covered more of that. They have case management to really help dig into all that. And they even have grants in case something you need a little bit of help paying for something. So let's talk about COBRA. COBRA is a federal law that allows you to temporarily continue employer-based health insurance if you lose it. The big caveat with COBRA is whatever your employer was paying for when it comes to your health insurance. So you may have been paying, you know, nothing, or $20 a month or $80 a month or whatever it was. But what you didn't see is they were still paying $400 a month for you in addition to what you were paying, or it may be significantly more than that they were paying. And now you're having to pay the full premium. So it can be a lot more expensive than you expected it to be. You may have better options on the marketplace. We'll kind of get into some of that, but it's good when you're facing that choice of, okay, I've got this COBRA paperwork. Instead of just blindly going into it, look into your other options so that you make an informed decision. So you may be COBRA eligible if you have employer-based health insurance and you quit your job, laid off, have your hours reduced to the point where you don't get insurance to them anymore. The person who you have coverage through becomes eligible for Medicare, or if that person dies or you get divorced, or if you age out of a parent's policy. So depending on the reason that you're qualifying for COBRA, the coverage can last anywhere from 18 to 36 months. And again, those premiums can be really expensive. It's hard to tell when you're signing up for health insurance when you first start at your job or you're doing your yearly, choosing which plan you want. You see how much you're paying, but you don't always see how much they're paying on the back end. A lot of times it's quite a bit they're paying for. And so when you get that COBRA explanation and how much you'll have to pay, it can be a little surprising. So always look for other options. But COBRA may be sometimes the best option, especially if you really like your plan and all of your doctors are, in network, things are going well with that, it may be worth it. So you have 60 days to elect COBRA coverage if you're interested in keeping that plan, and your premiums must be paid in a timely manner because you're used to it being taken out of your paycheck, and now you have to pay it. So you have to, send your check. And if your employer ceases their group health coverage, if they stop offering coverage to their employees, your COBRA will end because that group doesn't exist anymore. And if you become eligible for Medicare, your COBRA will end. Oh, another piece with COBRA is, say you get on COBRA halfway through the year and you've already paid, let's say you have a $6,000 deductible and you've already paid $3,000 into this plan, or $4,000 or $5,000 into this plan out of your pocket. You're getting very close to that deductible, or you've already met that deductible. If you go on COBRA, you don't lose that, all of what you've done. So if you've paid $5,000 of your $6,000 deductible and you go on COBRA, you still have that just $1,000, doesn't start over. So that's one reason some people will go on COBRA. So the federal government doesn't offer COBRA. Like if you leave a federal job, some church-related organizations and small companies a lot of times don't have to offer COBRA. And COBRA is temporary. So some options for when COBRA ends is moving to a family member's plan if another person in the family works and is offered insurance through their plan. You can purchase a plan through the healthcare marketplace. There's conversion where once COBRA ends, you can be offered an individual policy through the insurance company that you would pay for yourself outside of a group plan. So you would have an individual plan. Sometimes that can be even more pricey than when you had COBRA. So that may be an option, may not be an option. Or you can look into Medicare and Medicaid if you're eligible. So let's talk about the Affordable Care Act. So known as all sorts of things, healthcare reform, ACA, Obamacare, but did a lot of work toward helping people afford health insurance and healthcare. So now pre-existing conditions, it used to be that that a company could just say no to insuring you because you had cancer or have cancer or whatever. They can't do that anymore. They can't deny you. They can't charge you more for your premiums just because you have a medical condition. They used to be able to do that. And it allows dependents to stay, or children to stay on a parent's policy until they're 26, which is really nice. So it stops insurers from canceling coverage, except in fraud cases, of course. They can't just kick you off. It eliminates lifetime and annual limits for essential health benefits. Sometimes policies would have lifetime limits and annual limits of how much they would be willing to pay for somebody. It took that away. And most preventative care is free for most plans, most private plans and Medicare. So even if you have a high deductible plan, that shouldn't have anything to do with whether you can get your yearly wellness check. It doesn't apply to deductibles. You shouldn't have any copays or coinsurance when it comes to preventative care. So another thing it did is it expanded Medicaid. So all adults under 138% of federal poverty level are eligible for Medicaid. There are a lot of other things that can get you eligible for Medicaid, but that's a pretty universal one. And it's voluntary for states. Only 32 states have expanded. Iowa and Illinois both have. And it opened the state health insurance marketplace. So we've all heard of, healthcare.gov, the marketplace, being able to get insurance on your own. And it also standardized these different plan options. So there's bronze, silver, gold, platinum, and then catastrophic. So catastrophic are the cheapest ones, but they all have really high deductibles and don't cover a whole lot. Whereas a gold plan covers a whole lot and covers a higher percentage than a bronze plan would. And it also added financial help to pay for a marketplace plan. So the really nice thing about this is being able to get money off of your premium if you're lower income. So it's kind of a sliding scale where if you go on healthcare.gov and put in your application, they'll ask you what you expect to make that year, and they'll take a certain amount off of your premiums. One caveat with that is what's called the family gap. And so let's say one person in your family is eligible to get health insurance through their job. So for them, maybe it's very cheap. It's, $80 a month for just them, but then you're trying to add a spouse or child on now. They want $400, $500, $600, $700 a month to add that person on. It can be very, very expensive sometimes to add a dependent, depending on the plan and what the employer chooses to pay. Unfortunately, how the marketplace works is if that person who it would be $500 a month to go, or $600 or whatever a month through their spouse or parents' plan, even though they may not be eligible through their own job, because their spouse or whoever is eligible, they're not eligible for any tax credits. So you can still get a plan through the marketplace, but you would have to pay full price for it. But it's always something good to look into to see what type of cost you can get off of your premium. And so Medicaid is a great program for low-income individuals. There's a lot of criteria that goes into it and eligibility. It's a somewhat extensive process to apply, but once it's done, it's done, which is really nice. And you only have to renew it every year or so. It's funded by federal and state governments, and a lot of people can have, or some people can have Medicaid and Medicare, and they work very well together. So if somebody is old enough to have Medicare and they're low income, they can be dual eligible and have both. They do work really well together. So I put together here the Iowa and Illinois resources to apply for Medicaid. You can apply for them online. They do ask a lot of questions, so you'll have to get a lot of information together about your income, who lives in your household, etc. What's really nice is that both of those websites there, they have an option to just kind of get a guess of what you might be eligible for. If you don't want to put all of the information in just to see if maybe you're eligible, you can get a guess. It's not perfect, but it only takes 5 minutes to do that. So Medicare, we're going to get into quite a bit about Medicare here. So Medicare is federal health insurance for most people who are 65 and older, anyone who's had SSDI for 2 years or more, people entitled to railroad retirement benefits, people with end-stage kidney disease and ALS. I mean, we've all heard of Medicare, and it can be a little bit complicated. So I'm going to go through and explain Medicare kind of basics here. So there are a lot of different pieces of Medicare. So with original Medicare, because we'll talk about Medicare Advantage in a bit. Original Medicare, the big pieces are A and B. Part A is your hospital insurance, so your inpatient care. Anytime you are admitted to the hospital, that's your Part A plan. And that's free for most Medicare beneficiaries. And then B is your doctor insurance, your outpatient care. So what we would give whenever we go to the doctor. There are a lot of things that Part B covers. So that's your primary doctor. That would be oncologist visits. That's any infusions, x-rays, lab procedures, anything like that is Part B. So you can decline Part B, and it does have an additional premium every month that usually gets taken out of like a Social Security check, or you can pay them directly. You can decline Part B if you want to, but if you ever want it back someday, you may have a penalty. So really look into whether or not you can turn down Part B if you're hoping to, and what that might do. So big thing with Medicare is it's 80-20 coverage. So Medicare pays for 80% after your deductible, and you pay 20%. That's non-negotiable. That's just how it is. So if you want help paying for that 20%, because there's no out-of-pocket max with Medicare. So you're going to pay 20% no matter how much you're getting, how much care you're getting, especially with like chemo infusions, those can really add up. You may want to look into getting a Medigap or supplemental plan, which usually pays for the other 20%, depending on how the supplemental plan covers things. So Part C is also called Medicare Advantage. So Part C is, instead of going through original Medicare where you have A and B, plus a drug plan, plus a supplement plan, where you have all these cards, you basically sell your Medicare to a private third-party insurance and they manage it for you. There are a lot of good things about it and a lot of bad things about it. So you have to compare again with everything with this. You have to compare. So the nice thing is you have one card instead of however many cards you may have, because depending on, you could have your original Medicare card, you could have your Part D card, you could have your supplement card, and there may be other things around. That can get a little complicated to manage. So you would only have one card. Some of the issues with it are you're dealing with HMOs and PPOs again. So everywhere takes Medicare, basically everywhere. So with Medicare, original Medicare, you can go anywhere you want. With Medicare Advantage, a lot of times you're dealing with an HMO or a PPO where your network is going to be smaller. So you'll have to keep your doctors and hospitals in that network or pay out-of-pocket prices. One thing about Medicare Advantage, a lot of times they offer very low or sometimes no premiums or deductibles. They make it super affordable month to month just to be in the plan a lot of times. But then you may have a higher out-of-pocket cost when it comes to seeing your doctors, because you may have more copays. It just kind of depends. You have to look into the plans and make an educated guess about how much you're going to use that plan. So strongly encourage reading the fine print with Part C. A lot of times you'll get things in the mail, you'll see TV ads that really make it sound great. And sometimes they are. They make it sound very cheap, and maybe they cover things that original Medicare doesn't. Like some of them have like vision and dental help that Medicare won't pay for. But make sure you look at the fine print and see how limited your network may be, and see what, if you go to an out-of-network provider, how much you would have to pay, and make an educated guess of what's best for you. So we're going to talk about drug coverage now. So Medicare Part D can be really complicated, but it's your prescription drug coverage through Medicare. Different plans in every state. So Iowa has different plans than Illinois has. And it's not automatic that you're enrolled in Part D. You have to choose a plan. And again, just like Part B, if you choose not to take Part D, say, you turn 65, you're just first enrolling in Medicare, you don't take any drugs, or you just take one thing that's over the counter, you don't really need drug insurance. Unfortunately, if you just choose not to take Part D. If later in life, you start getting prescribed things, you're like, I do need a drug plan, you may have a penalty for that. So look into what those penalties are. One thing that I would always suggest for anyone going into Medicare is see a SHIP counselor. In Illinois, it's SHIP, and then in Iowa, it's SHIIP. Google SHIP. They are trained Medicare volunteers that know a whole lot about Medicare. They've been trained for days, take a big test, and they can help you figure out what coverage is going to be best for you. Explain that difference between original Medicare and Medicare Advantage, and really actually to the dollar help you compare plans. And it's free, and they're not paid by an insurance company. So if you have an insurance broker, that's great. And if you trust them, that's great. But they are there to sell you a plan, whereas these SHIP volunteers don't get paid. They're volunteers, for one. And two, they don't get paid differently or whatever based on what plan you choose. They're just there to help, and they're experts in what they do. So when it comes to Part D, one thing is making sure that your drugs are in network. So a SHIP counselor can really help with that, because how would you know? I mean, you can go on their website and find their formulary, but it can be really complicated. A SHIP counselor can go in and compare plans, put your drugs in to the point of putting in the milligrams and how often you take it to see exactly, it's an estimation, but it's a pretty good estimation of how much you would pay for your drugs on XYZ plans. But one thing we're going to talk about are the odd little steps in Medicare Part D. So the first piece is when you first get, it's January 1st and it's day one of your plan, you're in your deductible. So the first piece you're going to pay out of pocket for a little while. So right now it's $445 is the standard deductible for Part D. Some plans are $0. Some plans are a little bit different. Most plans, the deductible will be $445. So that first $445 worth of drugs that you're prescribed and you go to the pharmacy to get, you're going to have to pay out of pocket. The plan's not going to pay for any of it. If their deductible is $0, that's not true. You start right in the next stage. So based on retail costs, after $445, once you pay $445 out of pocket, you go into the initial coverage period. So this is between that $445 and $4,130. Based on retail cost. It may not be necessarily what you pay. So at that point, you'll have co-pays and co-insurance. Most people kind of stay in this area. If you're getting generic drugs, a lot of people don't leave this step, this initial coverage step. But if you're dealing with cancer drugs, a lot of times you're going to skyrocket right past the initial coverage into the coverage gap into step 4 catastrophic coverage by February. So you need to know more of how this is going to play out. So step 3, after that $4,130 of retail costs, you jump into the coverage gap. So this used to be really bad with the donut hole that closed in 2020, but it can be a little different. A lot of times you'll pay the same for initial coverage and coverage gap. It depends on the insurance. Sometimes it's a little different. It's a whole complicated thing, but basically you pay 25% of your drug cost, whether or not that's generic or brand name. So know that 25% of a brand name drug may be very expensive. It just kind of depends on the situation. And then once you get past $6,550 based on true out-of-pocket, so it's where it gets a little weird. The initial coverage is based on retail costs and the coverage gap is based on true out-of-pocket. Once you get past $6,550, you jump into catastrophic coverage. A lot of people dealing with cancer treatment, oral chemo drugs, things like that are going to jump into this really quickly. And the member at that point pays very little. You pay 5%, whatever's greater of 5%, or there's some numbers down there, of your drugs. Unfortunately, again, there's there's not a cap. So 5% of a $20,000 drug is still very expensive, but there are luckily extra helpers that can work with some of this. But if you have generic drugs and you're in the catastrophic coverage, usually you're not going to pay a whole lot. This is just another kind of show of what it looks like in those different deductible, initial coverage phase, coverage gap, and catastrophic coverage. So most insurance policies include a prescription drug benefit. So we're just talking about prescription insurance in general, not necessarily Part D with Medicare. Often it's managed by a company other than your insurance company, and that's why on the back of the card, it'll usually have a separate number for drugs. So know which number to call when it's a doctor type bill and know what to call when it's a drug. And again, always keep careful notes about everything. And also, this is a really good point about pharmacies and mail order pharmacies. So know what your preferred pharmacies are when it comes to your health insurance. So some insurances work really well with a specific pharmacy, like they'll work really well with Walgreens or CVS or Walmart. And then if you get your drugs through those companies, it's much cheaper than if you try to go somewhere else. So if you have a specific pharmacy that you really need to go to, say you live in a rural area and there's only one pharmacy anywhere near you, you might want to gravitate toward a plan that works well with that pharmacy. If you live in a big city and you have, you have a Walgreens, a CVS, and a Walmart within 5 minutes of you, it may not matter, but it would probably matter which one of those it works well with. Some of them work great with all of them. It just depends. Always check on that so that you can plan and switch pharmacies if you're okay with that, or switch companies, whatever works, but that way you can optimize your cost saving. So the formulary is a fancy word for the list of medications that a drug, a health insurance company covers. So they can usually be prescribed without pre-authorization, this formulary, anything on the formulary. And the insurance company chooses this. Your doctor doesn't choose what drugs your health insurance does and doesn't cover. So if you need a non-formulary medication, which with a cancer treatment may happen, you may be prescribed something very specific that your plan doesn't really want to pay for. It's not prepared to pay for that without pre-authorization. So if your provider wants you on a non-formulary medication, the first thing you can do is check to see if there's a formulary equivalent. Maybe they're trying to use the brand name medication, there's a generic that's just as good. If not, you can talk with your healthcare provider about requesting special coverage from your insurance company. A lot of times you can get a drug covered, but you may have to go through some legwork to get it there. So there's step therapy that happens a lot of times with pain medication. They want to make sure that you need that more intense drug, which can take time and legwork, but sometimes you just have to go through it to get that drug covered. And appeal denials, just like with health insurance, with the doctor's insurance and hospital insurance, when I said earlier, doesn't hurt to appeal no matter what. It never hurts to appeal, especially if this is a drug you're going to have to take for a while. It's really expensive. Appeal, try and get that drug covered. And there is assistance if you don't have prescription coverage or have, limited prescription coverage, or you can't afford your copays. Like with Medicare, there's extra help. It's called extra help for helping with some of the Part D payments, and there's just there are a lot of things available, but they're sometimes in lots of different places. Like a lot of medication companies will give you like a coupon card that will make something that's seeming like it's going to be $300, and they'll say, oh, now you only have to pay $80 a month. So there are a lot of different ways to find these. And I think the next slide, yep. So the next slide is Needy Meds. It looks a little different than this now. This is a bit of an older version of their website. Is a really great place to start that search. But one thing that I would suggest, it depends on what insurance you have too, but you can always go to the manufacturer's website. Sometimes they'll have coupons right there that you can print off on your computer and bring to the pharmacy, and it gets cheaper immediately. But there are all sorts of different benefits, different ways to get help with this. So Needy Meds is a great option. Calling us, we can help with that search. There's not always a perfect answer, but a lot of times there's something that can be done to help with the costs. So let's dive into employment and disability. So lots of people with cancer work through treatment. Some people can, some people can't. Some people take some time off, some people lower their hours. It just really depends on your situation. Always talk to your healthcare team about what are next steps for you when it comes to your job. They should probably know what you do, so that, I mean, is there a lot of heavy lifting? Are you expected to be sitting for long times? Are you traveling for work? Know what your options are, and know what your options are when it comes to disability insurance as well. A few things to consider when deciding whether or not to work through treatment. Do you like your work? Is it a good distraction? Does it help? You know, when you're having a hard day at home, when you go to work, are you able to kind of put those things in the background and focus? That might be something that actually helps you during the treatment. What does your healthcare team recommend? Talk to your doctors and your nurses about, hey, this is what I do for a living. Do you think that's something that I'm going to be able to do once I start this treatment regimen? It may be very different for somebody who maybe does heavy lifting in a foundry versus somebody who works at a desk, based on what their treatment's going to be. Can I physically and mentally complete my work functions while I'm on my treatment? Ask your doctor about side effects you may see when you start the treatments. Are you going to be able to do what you did before while you're on that treatment? And then what are the financial implications if I take time away? So do I have some savings where I can take some time off work? Can I lower my hours so that I have time to get to my treatments and so that I have time to take for myself when not feeling well? I added a great resource here at the bottom, cancerandcareers.org. Is a great place. It's got all sorts of resources about your rights as a worker and help that you can ask for, all sorts of great things there. So FMLA is a great law, and it can be used for medical leave to care for yourself, for a spouse, parent, or minor child. But you do have to meet some eligibility criteria. So it allows you to get 12 work weeks of unpaid leave during any 12-month period. And it keeps your job and health insurance. Like, you can't lose those things. So the eligibility is you have to have a bigger employer usually, and you have to have worked there for 12 months. They don't have to be consecutive though, and a certain number of hours, so 1,250 hours. The nice thing is, even if you have a smaller company or organization that you work for, if you go to them with, this is up to you if you want to disclose your health information, but if you know that you're going to have to take some time off for some treatment, a lot of places, depending on the organization or the company, you can get in writing that, yep, I'm going to take some time off. They're going to hold my job. But the unfortunate thing is that's up to the company. And it's up to you whether or not you disclose your health stuff to your company, especially if they're not providing your insurance. So just a little touch on Americans with Disabilities Act. Know that if you have a disability, you can ask for reasonable accommodations at work, and you can't be, denied a job because of a disability, and you have the right to request reasonable accommodations to be able to do your job with your disability. and a couple of resources there to, if you have any questions about Americans with Disabilities Act. So for a little bit here, we're going to get into SSDI, so Social Security Disability. So this is federal long-term disability insurance. You may be eligible for this if you've worked long enough and recently enough to have paid into Social Security. And then you have to also have a medical condition that meets Social Security's definition of disability. So I would always suggest going to ssa.gov. You can apply for SSDI online, in person, on the phone. But you'll need a whole lot of stuff to get started. It is a bit of a lengthy application. So there's the whole list of things on the screen right now that you would need. And then the compassionate allowances are their definitions of different medical conditions that meet Social Security's standards. So if you're approved, payments usually start the 6th month after you stop working due to that disability. And the amount of your benefit is based on how much you paid into the system. If you're approved, you can extend your COBRA for 11 months. And after 2 years of getting checks, you qualify for Medicare. So a lot of times this is a really great way to get Medicare before you're 65 if you know you're going to be disabled long-term. Unfortunately, a lot of people get turned down for Social Security disability. Here a lot of people get turned down the first time they apply. This statistic I found it was Disability Benefit Center. It's more than 80% of Iowa Social Security disability applicants will be denied. So it's huge, the number of people who get denied the first time, but you can appeal. So you can go into reconsideration, which is basically just a first level appeal, which sometimes really does work. And then I think, yeah, even 80% of those people may get denied. I'm not a huge expert in Social Security disability, but luckily there's a lot of information out there and a lot of people who can help with it. But then once you go to that next step, so say you apply for disability, you do that first level appeal, they still deny you, and then you get a hearing. Sometimes it takes a while to get that hearing, but a lot of people do get awarded after that hearing. So 2/3 of Iowa Social Security disability applicants are awarded benefit after their hearing. So sometimes it takes some legwork, some time to get there, but your chances after you get to that point are good. And then you can always go through the federal court system as well. And if you do get approved on appeal, you may be eligible for retroactive benefits. So SSI is more of an entitlement program and it's like needs-based for individuals who are blind, aged, or disabled. So some people are like, there's an income and resource eligibility guidelines for this one. And some people may receive SSI and SSDI. It can get a little confusing with all those acronyms, but say someone is getting SSDI and maybe they haven't worked a whole lot. And so their disability payment's really low, like say it's $500 a month. And that's significantly below the national SSI threshold. And so they may be able to get a check from SSI to get them up to the SSI threshold. There are other types of disability insurance, like through a job, private disability insurance, things like that. Let's talk about income and managing medical debt. So this is one of those things where there are just community resources, nonprofits, organizations, community programs that help with financial assistance in general. Cancer treatment can be expensive in ways that aren't just things that you would apply, send to your health insurance to pay for it. You may have to look into more things to help with transportation, or you may lose some work hours and need to up your income somehow to pay for some things, your mortgage, rent, light bills, things like that. So there are things that you can do to help with those. Like there's LIHEAP to help with energy bills if you're not able to pay for those. So always look for community resources if you're having trouble paying for anything. There's also credit counseling if that's something that you're looking into. So for a few of the things that we're going to get into to help with finances, it's advised to work with a financial advisor. But if you do this, just make sure you're really looking into who this person is, what are their credentials, do they have experience with somebody who's gone through cancer treatment, what are they and what are they not familiar with, and how much do they charge and how do they determine that. So some employers permit borrowing from retirement funds. So if you're in a hardship, you may be able to borrow some of your money that you save for retirement to pay for that. But there are always penalties for taking things out early. And like I said, this is recommending that you speak with a financial planner before or advisor before you just take money out of your retirement funds, but just make sure you're going to a reputable financial planner. You can also borrow money from your life insurance policy. There are a couple of different things here that you can do. Some people can get their death benefit ahead of their death if they're determined to be terminally ill. That may be an option if you need to pay for some things. And then there's another thing called a viatical settlement that allows you to basically sell your life insurance, usually for less than its face value for cash, but then there's no death benefit at that point. And before cashing in on life insurance policies, again, it's a good idea to talk to somebody. Reverse mortgage is an option for people who own their home to be able to borrow against their equity. Again, that's one where you want to talk to somebody before making that decision. And just in general, there are resources available. There's no way that one person can know about all of them. So call us, call our hotline. Best time to start is now. If you know you're going to see some medical bills coming your way, it's best to start now than wait until it's too late and you're inundated with bills and feeling bogged down. Start looking for things before the bills start coming in. But hey, if you have a pile of bills on your counter and it's already to that point, give us a call. It's never too late either. So if you give us a call, what happens when you come to us with a financial concern? I just wanted to go through some steps of what we can do. So first, when you call us, we're going to gather some information. Not everybody's financial situation is the same. Not everyone's cancer situation is the same. And we need some base information to be able to figure out what benefits are available to help. So we're going to ask you what you're having trouble affording. If that's medical bills, if it's a drug, if it's your rent, if it's transportation, whatever that may be, what are you having trouble affording? What type of income and savings are we working with here? A lot of benefits like SSI and things like that have income and savings limits. Like Medicaid has an income limit, things like that. So we need to know, is your income close to that? Is it definitely within that? Is it definitely not within that? So we know whether to not even look into some of those things. What type of insurance do you have now? We can, always look into is your insurance the right type of insurance for you? And just looking into different options when it comes to that. And then what type of resources do you have available to you? Do you have maybe insurance through someone else in the household that you could get onto? Are you part of a really great church system that maybe has some funds available to help? All sort of just like your resources in your life. And then also your cancer type and your situation when it comes to cancer. There are different organizations out there that give to very specific things. And so just different little situations or pieces of your situation may get you into an organization that gives money. And so what we're going to do is we're going to try and find community resources to help you with the direct costs. So we don't provide money ourselves, but we can provide those resources and referrals. So if it's a drug you can't afford or a health insurance thing will try to get you resources to help with that direct thing. But if those kind of fumble and they don't help, there's not always a perfect thing, a perfect solution. We can also try and find you resources to help with other costs in your life so you can save money from that and apply it to the thing you're having trouble affording. So say you're having trouble affording your rent, you're a couple $100, a month, or even just a little bit under every month on your rent payment. You're having trouble staying above water there. Maybe we can help get you some money off of your light and gas bill. And now if you get $100 off of your light and gas bill, now you can put that towards your rent payment. So problem solving, where can we save you money so that you can put that money where you need it? And then we also have social workers in our organization. We have headquarters that we can call and see if there are other resources that they know of. And we just have a really big network of different nonprofits and different organizations that we can reach out to see if they know of, other resources that maybe we don't even know of. So when you come and you tap into us, you're tapping into a big community of help. So just getting into some CSC resources here. This 888-793-9355 number is our cancer support helpline. It's a really great place if we're not available, or sometimes we call the helpline if we're kind of stuck on resources. We know sometimes what we have local, but sometimes there are nationwide things that we don't know of, and that's a great resource to get some referrals. And the Frankly Speaking one on the bottom here is what you're seeing right now, our educational series where we bring in doctors, nurses, social workers about different cancer topics. And then the one in the middle here, Open Options, is one of our least used programs at Gilda's Club Quad Cities that I love to talk about. It's a great treatment decision counseling program. So it's a one-on-one program, one of our only one-on-one programs that we have. And what we do in that is if you are facing a treatment decision, say, your doctor says you can get a mastectomy or you can get a lumpectomy with XYZ, and you're trying to decide and really go through those pros and cons and figure out what you need to do before an appointment where you need to make a treatment decision. You can sit down with one of our social workers trained in this program and really get at your situation, your options, your goals, and come up with a list of questions to bring to your doctor. And once you have this list of questions to bring to your doctor, theoretically, once you get the answers to these questions, you'll have all the tools you need to make your treatment decision. It won't make the decision, for you, but it should give you all the tools that you need to make that decision. Another thing I always love to talk about is our Cancer Experience Registry. It's a really great place to get your voice heard. So it's really a big kind of research survey that asks quite a few questions from anyone with a diagnosed survivor and caregivers to really get your voice heard. So all the answers that come from this survey are used to educate the medical community, so doctors, educate policymakers. The data is used to impact laws and really help guide things like what we do. And here's the link to join. If you're interested, it takes a few minutes to set up, and then you go through the survey. And it's a really great resource for yourself to get your voice heard, and it's also a great resource for the cancer community at large to get some data to use to affect change. We also have a grassroots movement. This is great on impacting change as well. It's that big, scary word, advocacy. Sounds like something that we all want to do, but can be really scary to look at how do I do advocacy. So we try to make it easy, and you can join our grassroots movement. And in there, you will find big ways that you can impact change, the big scary things that we all think of, but there are also little easier things that we can do to affect change. So if you even want to take one little step, join our grassroots movement. It's great. And I'm just going to check our Facebook feed for any comments. I don't see any right now. Just checking. All right, I don't see any, so I'm going to end this Facebook Live. I want to thank our sponsors for this program, or just who paid for making the wonderful slide deck. And I just want to thank everyone for watching throughout this time. And if you have any questions, give us a call or go on our website, guildsclubqc.org, or 563-326-7504. We're always available. So thank you so much for joining.